Presently, there are 3 ways to treat nail fungus. There are pros and cons to each method. Just remember, getting rid of nail fungus is not easy. The worse the condition, the harder it is to eradicate. The simplest, safest method is applying topical medication. You have seen ads in magazines, newspapers, and all over the internet, for various topical preparations. The problem? They rarely work. Even the prescription topical medications have a success rate of around 26%. That means a 74% failure rate. Topicals have a higher success with simple nail infections. They will have no effect on the fungus nails pictured here. Applying it to the nails is almost never enough. You must have the thick nails ground down periodically, in order for the medication to stand any chance of working. The next method of treatment is oral medication. If you have done any previous research, you will have read how the medication has a lot of side effects. However, if properly monitored with blood tests, the medication can be fairly safe for most individuals. Diabetics and people on cholesterol medication are generally not candidates for oral medication because the medications they are on adversely affects the liver, as does the oral antifungals. Oral antifungals can also adversely affect your kidney and your blood picture. Oral antifungals have a success rate of around 70%, and that is because the oral medication only destroys the 2 main types of fungus, but most nail infections are mixed infections, meaning there are other organisms causing the thick discoloration in the nails, and the orals will not help. The last option is laser surgery. Laser surgery is a painless procedure that has a higher success rate than topical or oral medication. It is usually a one-time procedure, but sometimes it has to be repeated. Generally speaking, the more nails that are infected, the less likely that all of them will clear up. If there is a downside to laser treatment, it is the fact that it is an out-of-pocket expense, meaning health insurance will not pay for it. It is a covered expense under health savings accounts and employer health spending accounts. Keep in mind, with all 3 treatments, results are not immediate. Unlike skin conditions that will return to normal once medication is applied, nail fungus does not immediately disappear. Once killed, the fungus will continually grow forward, and as you cut your nails, the dead diseased nail will be cut away, eventually replaced by healthy nail. I have been treating nail fungus for over 35 years and will tell you, it is not easy to eradicate, but if you make a commitment to it, your chances of success are greatly increased. Read the full discussion at www.foot-pain-explained.com/nail-fungus.com.